Hello and welcome to the New Indian Express Online. I'm Bansi Kadapa. With me is the newly elected Member of Parliament from Davangere, Mrs. Mallikarjun. Well, Doctor, welcome on the show.
Thank you so much.
Hello. First of all, as a woman in politics, you're one of the, let's say we still don't have that 50% women representation in politics. So, as a woman in politics, how do you encourage more women to be in politics? Because there are certain issues only women can take up and represent.
See, there are many issues which we can look into. Now, as a woman parliamentarian, I could look at it as from the perspective of constituency issues. There are many women voters who can be addressed, their issues can be solved in a much better way. As women parliamentarian, we can dedicate that time and the patience and follow up. So in terms of this, I think as women parliamentarians, we can do much better work in the constituency matters. Now, in terms of representation, yes, we do have less than 15% representation in the parliament, but in terms of encouraging fellow politicians, we will be their voice. We can look at their struggles right from the grassroots, their achievements and representation at the panchayat level and even gram panchayat, taluk panchayat levels and even in the state politics. So we can be their voice and we can work together as a team.
Okay. And there's also, people say as an electorate, they say when there's a woman politician, there's a mother's touch. So have you experienced, an opportunity for that in Davangere in the period that you've been a member of parliament?
See, there are many such issues, be it issues related to health or their child's employment issues or a student who cannot perceive higher education because of fees constraints or their accommodation in hostels.
Surely, yes.
Now, these are issues wherein we as women parliamentarians, we have the time to look into the issues and we will talk to the respective departments and see that we connect them and accommodate them in issues. Now, in terms of speaking about health issues, now women go through many health issues because of poverty. They cannot get the right treatment at the district hospitals. So through PM Relief Fund and even CM Relief Fund, we are connecting these patients to the hospitals and see that their treatment is done in the best possible way.
Okay. Also, you have, become member of parliament of this constituency, Davangere, which is virtually in the center of Karnataka. So, will you leave it the same way as you got it? What is your plan for development here?
See, I would like to say that I believe in comprehensive approach, wherein we look at education, health, employment, and provision of basic infrastructure. And definitely, we have in my constituency, especially, there are 7 MLAs in Congress. My husband is the district minister as well. So, and the state government is also Congress government. So we can work together and see that we do concrete work in terms of setting up IT hub in Davangere constituency, government industries, and even the infrastructure, the roads could be much better after the 5 years term.
All right, your plan for the future. Do you have something to tell the viewer?
Plans for the future would be regarding health infrastructure. I would like to strengthen the entire health
Being a
care.
doctor.
Yeah, being a doctor. And we also have a trust, an NGO. I'm also the life trustee in an NGO. And since the past 6 years, we have been giving free services to the people of Davangere. Till date, we have given around 20,000 free dialysis cycles to the BPL card holders and free deliveries, cataract surgeries to the public. And right now we have started with the PPP model wherein our NGO trust and our medical and dental colleges will be tying up with the government program, the NCD cell program. And as a pilot project, we have started this program in one of our wards in Davangere city, wherein the ASHA workers will be visiting each and every home, and with a CBAC form, she will be collecting details of the non-communicable diseases. It could be diabetes, hypertension, and cancer. And in cancers, in particular, the breast, cervical, and oral cancers, we are right now stressing upon. And we are trying to saturate the entire women's population in a ward, and then refer these women with symptoms to our hospital in Davangere, wherein all the investigations will be done, and then if found positive, they will be referred to the government hospitals. So our aim is to see that every woman in Davangere above 35 years of age, she has to undergo pap smear test and even examination for breast cancer. So along with the awareness on cancer and non-communicable diseases, we are trying to fill the gaps existing in the government system through concrete approach and the diagnostics, be it mammogram, biopsy, and the basic investigations will be conducted by our hospitals. So very looking forward to this project, wherein we are looking at women's health empowerment in Davangere.
Thank you for joining us with all those details. There it is, the newly elected member of parliament from Davangere with all those details. Thank you for joining us.